Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community. Welcome to another episode of Sky Women. I am so glad you're with us today. Thank you for joining wherever you are. Grab a beverage, hang out. Let's have a chat with Dr. Val, who is an expert integrative sleep medicine physician and perimenopausal women's sleep coach. I mean, we need this in our lives. We all are going to go through menopause at some point. And Dr. Val's mission is to end exhaustion for women in and around menopause to get better sleep. And with her significant professional background in internal sleep and integrative medicine, she is really helping us to find a way to improve sleep so we can wake up feeling rested, restored, and renewed with energy. And I, for one, am delighted to be talking to you today. We even coordinated our tops. We're both.
I know. I was thinking that when you popped on. Yeah. Thank you so much, Dr. Moyers. Very happy to be here.
Yeah. Thank you for joining us. We were just discussing before we hit record, and we're not exactly sure how we got connected, but delighted to, because as you know, I am North American Menopause Society certified menopause provider. And the reason I did that is because there is such a there's just a paucity of really excellent menopausal care, right? And as I get closer to menopause, I got concerned as well. Like, you know, we learned this basic information in OB-GYN residency, which is very heavily OB focused. And so I feel like in the gynecology realm, a lot of times these symptoms get dismissed, right? And recently in the last year, you know, patients have come to me who have seen multiple providers before and been told it's all in your head or you're too young. And, you know, but you listen to their symptoms and it's classic menopause. Right. I don't care if you're 42, like these are classic perimenopausal symptoms. And so I'm so glad that as an internal medicine physician, you know, you're incorporating integrative medicine, you're boarded in sleep medicine. This is such a big piece of menopause. Women report, I can't stay asleep.
Yes.
I wake up so tired. I don't know what to do. And part of it, right, is that we've got all these things that we're multitasking at this age where we've got kids and then we've got aging parents and we've got a job and, you know, all of the things that are going on, which makes it hard to like, in terms of like turning off that brain to go to sleep, right? And so we think it's because we've got the ever-growing to-do list, but there may be more there. So fill us in, friend. Like, where are you in the country? You have a physical practice, but then you also do coaching for people who are not in the states where you are boarded, right?
Exactly. Yeah. So I'm originally from California and I'm in California right now. And my office actually is in Hawaii on the island of Oahu. So for the past about 6.5 years, my husband and I, my family were living in Oahu. And then we decided, you know, with the pandemic and everything to come back home. So I have an office there. And so I help, you know, the good thing about sleep, I don't have to necessarily physically examine them. A lot of my visits are via Zoom. So I do telehealth for folks who live in Hawaii or California. And so, you know, I was working in a corporate medicine job for a long time, running a sleep lab. And a lot of the patients were coming through who the primary care physicians would send over for, you know, adult age, perimenopausal age women with sort of similar symptoms, like vague symptoms, fatigue, palpitations, or blood pressure was going high. She's really stressed out from work and family. Just
I can't lose any weight.
I can't lose weight. Yeah. And I was just thinking like, there's something going on here. Right. And it's so interesting because the whole menopause is sort of like sleep in terms of how we really had a lack of information provided to us as medical students. You know, even in, you know, residency, maybe I had one lecture about sleep. Maybe I had one lecture about menopause. And now,
and we weren't sleeping anyways, right? In medical training.
Exactly. Yeah. Sleep, it's just as important as eating and breathing and drinking water. But yeah, it's very not prioritized. And so just out of that, like learning about it, being really passionate about it, and then really wanting to help women because I feel like myself, you know, menopause is just in around the corner.
Yeah.
And I really wanted to be prepared. I've had my own sleep issues, working night shift, having insomnia as a med student.
Right.
Yeah. And so just going through this, it really makes a difference, the quality of sleep you have, and then being able to have important conversations for women around it. Because one of the biggest concerns is, well, I'm waking up in the middle of the night. And if you go on any forum, it's like, all right, try this CBD, try this melatonin, try this magnesium, which, in the right person, that certainly can help. But part of the way I practice is holistically. It's taking that approach. Okay, well, is it because you're stressed out because you have this big project at work and your mom is also going through surgery? Or, do you have, problems with your blood sugar dropping at night because someone you read online said to do intermittent fasting and you just have stopped eating and now your liver can't handle that? Or do you have an undiagnosed, sleep condition like obstructive sleep apnea, which, definitely is more prevalent as we get older, A, from aging, but also B, from decreased levels of estrogen, progesterone, which are protective to keep the airway muscles nice and strong, right? Women.
That is interesting. So that's why we're seeing more sleep apnea in postmenopausal women.
Yeah, double to triple. And the thing about sleep apnea in women, there's a gender bias in medicine. A lot of the studies were not performed in women. So some of the research that I've been reading, it's, a woman who's overweight goes to their physician and said, I'm tired. And they go, okay, let me check your thyroid, or let me send you to the therapist to talk about your depression. Versus a man who's overweight or obese, sleepy, okay, you're going to get a sleep study.
Right.
But, the rates of sleep apnea, it's so underdiagnosed. 1 in 5 adults have it. And we sort of catch up to men as we go through perimenopause and menopause. So it's really something that shouldn't be ignored. But women also don't present the same way. Not everyone who has sleep apnea snores, right? Women, sometimes it's subtle. We can just feel more moody, more fatigued. Headache in the morning is one of the big ones. Plus, if your partner is snoring away, he or she can't tell you if you snore. So
so that irritability is a huge complaint for more short fused with the family. And that really gets to women because they feel like, this is not who I am.
Exactly.
I don't know how to control this. I'm just so short fused and irritable.
Yeah. And when you don't get good sleep, mood is one of the first things to go.
Oh, totally. Totally. I always say with a couple of hours of good sleep, nothing has changed out in my world except for what's between my ears. Right.
Right. Yeah. So there's a lot of things to discuss within the, perimenopause and sleep world. Yeah. Because is it perimenopause? Is it sleep? Is it thyroid issues? Or is it aging in and of itself? Right. Getting older is associated with changes in your sleep architecture. You have less deep sleep. You have less REM sleep, which can also lead to things like, fatigue and not feeling well. So it's a combination of factors.
Yeah. So let me understand this correctly. You do telehealth in California and in Hawaii now because you're not physically there, but you have a physical office there.
Yes.
Okay. And then you have this coaching program called Sleephoria.
Oh, Sleephoria. So like Sleephoria and sleep.
Yeah. Okay. Sleephoria. Okay. And so this is where you are coaching women on how to optimize their sleep. So let's kind of run through what that might look like working with you, say a busy professional woman who's mom to multiple kiddos, doesn't know the last time she's gotten a night's sleep that is uninterrupted and is doing all of the things, probably wakes up at 3 a.m. with a list of to-dos or a great idea or the shopping list, and has a hard time falling back to sleep. Where do we start?
Yeah, that's a great question. And so the framework that I have, it's really, I call it mind, body, and soul approach, right? Taking that holistic view.
Love it. Yes.
You can't separate your brain from your body, right?
No.
Starting from the brain, right? Starting from the mind, that list, right? That list of things to do, the thoughts of, your busy family, your busy work.
Yeah.
And so making sure that you break that down during the daytime. So what doesn't come out at night? And what does that look like? For some people, it's journaling. For some people, it's having your to-do list done and then sort of setting it and forgetting it till it comes back. Because one thing really to note is when it's 3 o'clock in the morning, what are you going to do? I guess now with the fact that we have, Instacart and like the Target app, I guess you can technically go shopping on your phone.
That's right. Let me get my groceries for tomorrow.
Exactly. Getting all that done. But then taking a look like, okay, so what is keeping you from being able to relax? Unpacking that, getting curious with that. Are you doing enough self-care? Do you need to outsource? Do you need to ask for help? Right. And then that's the mind part, the body part, right? Are you having, palpitations that are waking you up at night? And if so, what does that cause from? Are those hormone changes? Or do you actually have an arrhythmia? Are you developing AFib? Or do you have untreated obstructive sleep apnea? So taking a look at the things that are going on in your body. And then the whole soul part, your relationships. As we get older, sometimes there's transitions that happen, maybe we're at a job that we've been at for the last 20, 30 years, and we've reached our plateau. We don't necessarily want to go up or, thinking about, okay, when my kids are in college, do I really want to continue running this team? Do I want to manage these people? Do I need to hit my sales goals continually? Or, maybe we've sort of put aside our passion projects. And now it's like, well, I'm, mid 50s. I can do something else. I see, people out there on the internet starting new careers. Is that something possible for me? So sometimes the purpose part of it, that sort of creeps up at night thinking like, I'm going to wake up in the morning and do the same thing. Am I going to do this for the next 10 years of my life? Or am I going to make that change? So working through that framework, our mind, our body, and our soul, and sort of unpacking that. And, coaching is doing it together. Sometimes I think of coaching as sort of like brainstorming together, asking those sort of probing questions, giving someone that time and space to really examine what's going on in their life and what they want their life to look like.
Yeah. I love that. It is definitely an integrative approach. Like you have to look at all of those things, because if you have a strained relationship that you're not dealing with, like that is definitely going to create
like there's no amount of melatonin that's going to fix that.
100%. Yeah. So I love to unpack that too. And in like a well-woman visit or an initial visit, we may take 60 to 90 minutes just to kind of go over all of the things. And one of those being sleep. But I can imagine if we identify something, then I could point them in your direction to kind of work through those different issues. Some of the things that I always talk to patients about are like setting the mood, not being on electronics a few hours before sleep, making sure you have a cool, dark environment. I talk to them sometimes about adding magnesium in the evening. Do you have a particular dosage that you like?
Well, it depends on the brand, I'm sure. When you take a look at supplements.
Yes,
because they're
absolutely.
not FDA approved. So, sort of go by the manufacturer recommendations. Yeah. But typically magnesium glycinate, because it doesn't cause diarrhea. So, such like the citrate and the other ones do. Brand wise, I signed up for Consumer Labs. So they're like a third party that reviews the quality of certain companies. So life extensions, pure encapsulations are typically, I think, higher quality brands. But sometimes I tell patients to go to your local Whole Foods because they feel like their quality is better from them, like Target brands or even like Costco brands. Yeah. Okay. But magnesium is really helpful because women also can have more restless leg syndrome, more periodic limb movement disorder. And so magnesium is definitely a good help for that. It works on GABA and also helps relax the muscles as well.
Okay. Awesome. And so what is your take on melatonin?
Ooh, that's a whole podcast in and of itself. So melatonin is a natural hormone released by your pineal gland in response to darkness. It's really heavily and probably overly marketed here in the US as a sleeping pill, sleeping aid. But classically what we think of melatonin, sort of sleep research and sleep physicians, it helps with the timing of your sleep. So there's this graph I like to show some of my patients, and I show them about the circadian rhythm. And so melatonin starts to become released when it's dark out, typically 9, 10 p.m., depending on where you live. And it peaks in the early morning. And so it really peaks when our other biorhythm that controls our sleep, called our homeostatic drive, starts to plateaus. So what our homeostatic drive is basically the longer you're awake, the sleepier you get, right? And so you have to be awake for so long to be able to fall asleep. And then as you fall asleep throughout the night, you relieve that pressure. So the core amount of sleep is probably 5.5 hours. So if you're waking up after you see that because, hey, you have to wake up to go to the bathroom or there was a noise outside, the dog barked, and you have a hard time going back to sleep, it's because you're not as tired because your drive to stay asleep isn't as strong. And you can sort of see the curve is that's when melatonin peaks. So it does something to help control the stages of your sleep. We think of melatonin as like the person that starts the race, shoots off the gun. Okay, this is around the time you should be sleeping. It has some anti-inflammatory property, even anti-cancer property. It can help lower the body temperature a little bit and helps promote sleep as well. And then when the sun comes out, that tells melatonin to go away. You don't need to be asleep anymore. Melatonin can be mixed with things like magnesium, passion flower, hops. And those sort of agents are more sleep promoting because they can help relax the brain waves. Clinically, we use melatonin as a shifter of your sleep rhythm, your circadian rhythm. So people who are like jet lagged, or if you do shift work, melatonin can help sort of pull you towards sleep. But classically, we don't need it. There is one caveat though, because as we get older, guess what? We do have a decreased release of melatonin. So around the age of 50 to 60, it may be reasonable to take melatonin if you have a hard time even falling asleep or staying asleep. But also is going back to the formulation that you get. There was a big study in 2017 that said some of the melatonin out there was actually adulterated with serotonin. And so if you're on an antidepressant, you don't need more serotonin. And then even the dosage that you're getting may not be what the bottle in fact says. So having a high quality melatonin is important. And then melatonin can also have side effects. Yeah. Like lower blood pressure, increased risk for nightmares, headaches, even a hangover type effect the next day. So,
a hangover even with melatonin.
Yeah, sort of like Benadryl.
I was going to say, I always get one with Benadryl, but I honestly don't ever use melatonin. I hadn't heard that. Interesting.
So there's a lot of caveats around it. And if it works, good. But also if it doesn't work, don't waste your money on it.
Yeah. Okay. So you're unpacking if there's any medical problems, if there's any relationship problems, if we're managing our stress. What are your top tips for sleep?
My top tips. I love this question. So the first is always make sleep a priority because I feel like our culture here in the US is still very strongly a hustle.
Sleep when I die. Yeah.
I'll sleep when I die. When I'm retired. And it's like, well, if you're shortchanging yourself on sleep, 7 to 9 is the recommended. But for a lot of the cardiovascular literature, if you're getting 6 and above, it's probably good enough. So anything less than 6, really, I encourage you to take a look at, what is competing with your sleep.
Right.
So a lot of, women probably are doing all the things for their family, their work. And then at the end of the day, we call it revenge procrastination, right? We're in bed, or, going on our phones or, just
100%. And then you're like, how is it 11:30 and my alarm is going off?
So we sort of steal away from me time for sleep, which is almost if you get better sleep, then you're going to be able to perform better. Your brain works better. You're going to be happier. You're actually going to be more efficient.
And you might have more me time.
Yeah, exactly. Yeah. So the biggest is, make sleep a priority. Try to get at least 7, but if you're getting 6, that's okay as well. Control stress. Women have higher rates of mental health conditions in and of itself. And so do something for yourself on a regular basis, even if it's 5 minutes, whether it just be, go and have your favorite, I would say non-alcoholic drink because drinking alcohol can disrupt your sleep. I was just thinking like lemonade, I don't know if it's pretty hot right now in Texas, like have an iced tea or something. Yeah. But have some quiet time for yourself just to sit, whatever that looks like, listening to music, journaling, ideally if you do something not on your phone because your phone is like already wrapped up. So, we work on our phone, it's entertainment on our phone. If we can do something that's non-tech, just go outside and, stare at the clouds. I think that's really helpful. So unplug a little bit. Research shows even like 4 minutes is good. But have a dedicated time for yourself is really important. What else? Lifestyle. I'm really big on lifestyle. The things that we eat and how we move is also really important. So I know I mentioned alcohol, but if you are going to drink, I definitely recommend to do it as a happy hour or even a brunch thing instead of a nightcap because it can really disrupt the quality of sleep you get for your sleep stages. And then move your body. If you can do it earlier in the day, get up, go for a walk in the morning, get that bright sunshine in the morning, that does wonders to help your quality of sleep at night. Yeah, and help you fall asleep earlier. It makes you a little bit sleepier because it tells your brain, and this is when I should be awake. That sunshine is really alerting, especially for night owls that want to sleep a little bit earlier. You got to get more sunlight.
Okay. All right. So let's go back to the alcohol topic because we do definitely have a large wine culture, and a lot of moms, that's how they unwind, whether it's, kids finally go to bed and I'm going to have a glass of wine or a glass of wine with dinner, and 2 turns into 3. So how is that disrupting our sleep? And you said have it earlier in the day. So happy hour or brunch.
Yeah. Good question. Couple of reasons. The sugar of the wine and also the alcohol in and of itself can be disrupted for sleep. So sugar can cause spikes in our insulin. And actually, aside from drinking wine, they've done studies where we have more processed food at night, and we have less quality sleep, meaning we wake up more frequently. So that's not good, right? You want to have, as deep a sleep as possible, which as we get older, we're already getting shortchanged on that, just as natural process of aging.
Right.
And then alcohol. So alcohol makes you feel sleepy at night, right? Sort of calms you out, zens you out. And that's why a lot of women do it, because you're almost self-medicating yourself from maybe not being able to properly deal with your stress or having coping mechanisms.
Right. We call it buffering, right? We're buffering.
Yes. Yeah. Yes. Which, I understand it's very popular. It's common to do, but there's also a lot of other options that probably aren't disrupting for your sleep. So if you do have disruptive sleep and you're using alcohol, something just really to consider. Can you do it? Drink earlier.
To cut back or to shift it at a different time. Right.
Exactly. Okay. Yeah. Because as the alcohol products break down the second half of the night, you have more disruptions, more awakenings, and then less REM sleep as well. So makes you feel sleepy, but then after it breaks down, your sleep is actually more disrupted. Yeah.
Okay. So waking up at 3 a.m. because I've got to pee, can't get back to sleep. I lay down in bed and I've got the list running through my head and I'm thinking about my great aunt or whatever, you've got all these things going on in your head. What is your recommendation at that point? Should we get up? Should we journal? Should we read a book? Should we lay there and try to go to sleep?
Yes.
What do we do?
One of my favorite questions. Figure out why you're waking up. So waking up to urinate, obstructive sleep apnea that's untreated is associated with nocturia. So what obstructive sleep apnea is right, the muscles of the upper airway, typically it's the tongue that falls back and closes off the airway. If we have a narrowing in our upper airway, basically what happens is think of like the plumbing where you live. If there's a blockage in the plumbing downstream, there's more pressure. So we're going to take deeper breaths. Those deeper breaths, our hearts and the lungs are in the same cavity. The lungs will make the heart stretch the atrium and it'll signal down for our kidneys to tell us to wake up and urinate. So if you're having to urinate more than 2 times a night and your bladder is okay, you've emptied, you stopped drinking water. I know some women have told me, I stopped drinking water at 6 p.m. I was like, oh my goodness, aren't you thirsty by the time it's 9? But it's like, I can't, otherwise I pee. So I'm like, okay, well, make sure you don't have obstructive sleep apnea because once you open up that airway, you don't actually wake up as often enough. Yeah. So figuring out why, is it a low blood sugar? Is it obstructive sleep apnea? Is it the stress, anxiety? And then trying to figure out from what's causing the awakening, then you can match sort of the treatment or the remedy, right? So if it's because of that list is going and going, can you set aside a time earlier in the day, not too close to bedtime, where you sort of get it all out, right? Do that thought download. Sort out all those thoughts. Yeah.
Let's explain what a thought download is.
Well, the way I best describe it is everything that's in your mind, just write it down on a piece of paper. If you don't like to write, you can like talk it out in a voice memo or even type it out. A good analogy is like all the files that you're using on your computer and you're done with it. What do? Well, some people just have them hang out and you see their desktop and it's all over the place, but drag it to the trash bin, right? The recycle bin, and then delete it. So get it out there, sort of clear your cache, clear that RAM, clear your brain slate. So that when you're able to sleep, when it's time to sleep, you are able to sleep because those things aren't swirling around.
I love that tip. It is one of my favorite things to do where I just, no judgment, just write down like all the things that are in my head and then organize like my list of to-dos. Like, what can I do about that? What do I know that needs to happen tomorrow or whatever that's weighing on me? Can't do anything about it right now at bedtime. So I'm just going to write it all out. Don't judge it. And it's usually like a short list, like just quick topics.
So I don't judge it. Yeah, exactly.
Yeah, don't judge it. Yeah, absolutely. Mm-hmm. So I love that tip. I think it's really useful. Now, you've brought up a couple of like legitimate reasons other than just my hormones are imbalanced, because that's just infuriating to women, right? When we have no solution, rather than doing hormone replacement therapy, because that definitely will help. But that's a topic for another day. But you mentioned a couple of reasons why women would have difficulties with sleep, like restless leg syndrome, sleep apnea. What are are there any other top diagnoses that you see that are a cause of poor sleep, and what can we do about it?
Good question. Well, so from the medical sleep standpoint, definitely obstructive sleep apnea is very common. Restless leg syndrome, not as common. We actually see that more in and around pregnancy.
I was about to say that's a real common one in pregnancy.
Yeah, but it still can happen. Or at night, we call it periodic limb movement disorder, where up to 80% of people who have restless leg actually can kick their legs at night, and that has been associated with arousals. So for undiagnosed obstructive sleep apnea, to get a sleep study, you can do it at home. Technology is really great. You don't have to go to the lab anymore. Nice. And for restless leg syndrome, periodic limb syndrome, you can actually check your iron levels and ferritin, because if the ferritin is low, typically less than 50 or 75, taking iron can help. And then, we talked about what to do if you have a lot of stress in your life. But I think one of the things also is the mental health aspect. A big one is anxiety, right? Rates of anxiety can go up in women, especially if they don't understand what's going on with their body. I like to think of it, the hot flashes is the big issue. So, and it's not just like having the hot flash, it's the anticipation of having a hot flash. Sort of like when I used to work, night shift in the hospital, you have your pager and you don't know when it's going to go off. You're trying to
can't sleep because you can't sleep.
It's just like that. Exactly. Yes. I feel like that's probably what happens with a hot flash. If it happens so frequently, it's going to happen, but you almost like second guess yourself or put so much pressure on yourself, it's going to happen again, that you almost trigger it, because that anxiety.
Yeah, those night sweats are,
so it can be really uncomfortable, but there are treatment options for that. So, I would say don't shy away from talking to a physician who is specialized, who knows about menopause, who is part of the North American Menopause Society.
I think it makes
if you're not a candidate for hormones, there are other things that you can do.
Yeah, totally. And I think that is a huge issue, because I feel like women just really get taken advantage of. We prey on their insecurities in this time frame, this time of life. And I think quality care is just absolutely key. And there's so many people who are doing great work in this area. Like Heather Hirsch is one of those that come to mind right off of bat with, all of her amazing programs and her podcast, Health by Heather Hirsch. So so anybody who is struggling with menopause or perimenopausal symptoms, you need to go look up Heather Hirsch. She is fabulous. Go listen to her podcast. I love her. She's been on my podcast. You can find her on
she interviewed me as well. She's
perfect. Yeah, we got to get the word out. Okay. Well, I thank you so much for your expertise and lending your knowledge to my audience. This information is extremely helpful, because sleep is such a big part of our lives, and it impacts our health and our heart and our mental capacity. So all of us as we age definitely need to continue to get good sleep. And it's hard sometimes.
Yeah, it's hard, but I think at the end of the day, just feel like you're not alone. So,
yes.
40 to 60% of women during perimenopause, menopause have difficulty sleeping. And that number is way too high. So one of the biggest reasons I started Sleephoria is really just to educate women about it. That this does happen, but it doesn't you don't just have to deal with it and get on with it, like a lot of doctors probably have told you. So,
Oh, I love
our solutions out there.
You are not alone, because 40 to 60% of women who go through menopause are having these same symptoms. You are not alone.
Normalizing it makes it better. It takes a little bit of that anxiety away.
100%. Yes. Well, thank you for bringing this mainstream and for, figuring out creative ways to serve more women, because you're right. If you're licensed in certain states. That's the only place that you can physically practice. But by expanding it to coaching, you really can serve internationally. And I think that's phenomenal. Yeah.
Yeah, it's a great space. Thank you so much, Dr. Moyers. Happy to be here.
Thank you so much. Have a great day. Until next week, be well.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a neuromusculoskeletal medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.